Straight things to you as opposed to getting up in your chair and doing it, but you can follow along with me.
Is it million steps? What was it, the exact number?
This is the 8 million step treatment for an FRS. Just do $1 million roll, you get everything, man. So, here's what's happening. Remember how in the thoracic spine, Dr. Doris made a very good point in class that sometimes when we're treating the thoracic spine, especially with FRSs, that's why they're a little more involved. We have to try to get the facet unstuck from being so far forward in flexion that it's usually better practice and more comfortable for the patient to try to gap the side that the FRS, that the dysfunctional facet is on, so that we're not just closing down on that tight, stiff joint to get it to come back in extension. Same thing's going to come through here and come true here in the lower thoracic spine, except you can see it a lot more clearly. All right. So, in the example here, for the FRS to the right, okay, my positional dysfunction is this, and what you're going to help me do is you're going to help get me here. But if you were doing that all in one motion, there's a chance that I can cause compression within the joint, making it more painful for me.
That's one of the reasons people always hurt themselves lifting something to the ground, coming up too fast. Here, they get caught.
Too fast. So we want to always take that into consideration, especially when we're doing our treatments, because we want to follow those better physiologic motions. So what we can do, actually, is make a little bit of space, a little more space available initially for the segment to come back and finally end in extension. So the way that we can do that is, although I'm already translated and side bent to the right, okay, I'm translated left, I'm rotated right side bent. If during the correction, we're going to do this in neutral, I translate left and further side bend right. If I'm side bending right, which way is my spine rotating if I'm in neutral? To the left. So, by translating me left and side bending me right, or causing side bend right, I'm causing left rotation to occur. I need to have left rotation to correct out of my FRS to the right. Okay, so this is a good place to start. Start in neutral. So I translate left, side bent right, which is forcing me to left rotate. We're going to get there at that point and then implement some muscle energy to help. Take care, Dr.
Keys?
Yep, all like 12 of them.
Go home.
Hey,
Don't get his head.
hey, Pim.
Bye, Dr. Warner!
Oh my God.
All of that?
Show.
All right. So, broke the moment right as we were building.
Done.
You're right there.
It's gone.
You had that.
I had them at hello. Oh no, that's Jerry.
I didn't know that was
Thank you, somebody, for getting that. Thank you very much. All right. So, okay. So I'm translated left. I'm side bent right, which means I'm rotating left. Here's where we're going to start our muscle energy. You're going to resist right rotation. Okay? You're going to resist right rotation from behind through the patient's left shoulder. After you've done that, perhaps 1 or 2 times to help gap the joint and clear it out, you're then going to translate them in P to A to get the extension. You're now in extension, so your rotation is coupled with what motion? Side bending to what side? Same side. Because now you've engaged the facet. And finally closing them off into extension, side bending, rotation to the left, Because originally, positionally, they were diagnosed as a what? An FRS to the, which meant the which facet can't close because it's stuck where? Great, that's question number 4. Good. Now in this particular example, as you go lower into the spine, it's very customary, as opposed to just finishing out with extension on one side, to then ultimately bring them into extension bilaterally. Okay? It's just more comfortable for the spine, it puts less strain on the muscle tissue. Alright? So it's got a couple steps to it. Let's go through the steps and then we'll eventually treat the neutral dysfunction and we'll be done with at least the material from the book. Okay?
We'll do the rib next week then?
What about the...
I'm sorry? Wait, a couple people said something. I think you mentioned something about the rib.
The rib sublex?
We could do that. I'll give you an option. I'd really like to get you to know those cervical instabilities. And if I had to forego one thing to do tonight, the rib is pretty simple, which means we could start off next Saturday doing that. And we'll breeze through it like within 20 minutes. Alright? We'll be done with that like within a half hour. Okay, good. So let me have, Joanne, would you mind? Okay, thanks.
Go girl.
Sit here. That should be good. Okay, so what do we need to do? She's like this, right? She's down this way, right? FRS to the right. Okay? She's having trouble closing on the left. Because we're now in the lower thoracic spine and not in the cervical spine anymore, because we also did an upper thoracic. We need to try to gap open that facet that's not that's stuck open. Gap it a little more to make it easier to come home. Alright? Good. So what we're going to first do is we're going to find the level. And it's a T8-9 level. So I'm going to be right about here. Now in most cases we would be monitoring on this side, waiting for the transverse process to come into place. Dr. Greenman likes to monitor over here because he also wants to feel that side bending component come in to make sure that he's getting it enough to then implement the rotation to the left. Alright, so that's where we're going to start. So our palpation is the interspace at T8-9 over the transverse process of T8 on the right. We're going to first start by translating the patient to the left, causing right side bending, gapping along the left side. Everybody see that?
Yes.
Okay, so now we've cleared that opening. We've made it a lot better and easier for the left facet to start coming back into extension. I'm now going to hold here because we're side bending right, we're rotating left. What I want to do to facilitate more left rotation, I'm going to ask her, through the resistance of my hand, to try to turn right. Hold, 2, 3, 4, 5, relax. And I translate her more to the left, causing right side bend and left rotation. Notice she's still in neutral. If I bias it with flexion or extension, all bets are off. Okay? Let's do it one more time. Bring your left shoulder forward, rotate, hold. Good. 2, 3, 4, 5. Relax. 2, 3. Further side bend and rotate. Okay. Now we're going to change things a bit. I've got her into good rotation, and I'm going to translate her P to A for the extension, and now I have to get her to finish off in some side bending, so I got to translate her back. Okay? So now she's extended, side bent, and left rotated, and I still want to implement my muscle energy here. So I can ask her to try to bring her left shoulder forward and try to flex. hold, 2, 3, 4, 5, relax, good, and again, 2, 3, 4, 5, relax, good, and if I wanted to, I can also bring her up like this and finish off on the one-sided correction. Lift your left shoulder upward and try to go forward at the flexion. Relax. Good. And then I'll finish off in full extension now. More again with a P to A, so I'm not taking her all the way off the center of her body. Alright? So the key components there to treating the FRS to the right is to first gap the left side, instruct and achieve better rotation. Once we get that rotation through, then translate away from the side, creating more extension, rotation, side bending to the left, finishing off with muscle energy technique, and then ultimately with a nice P to A for bilateral extension. All right? Let's do that.